statement correctly describes which statement correctly describes Lactobacillus acidophilus? A. Prefer alkaline pH range. Letter B. Strict pathogen. Letter C. Produces large quantities of lactic acid. Or letter D. Characteristic tumbling motility. So for number 67, the answer is letter C. Produces large quantities of lactic acid. Hence, Lactobacillus acidophilus provides an acidic pH in the vaginal tract or vaginal canal, which prevents infection. So yung letter A po, prefers alkaline pH range. This one is true for your Vibrio. Hence, Vibrio is grown in alkaline peptone water broth. While strict pathogen, hindi po. Lactobacillus acidophilus is actually part of the normal flora and okay pa nga na merong presence ng Lactobacillus acidophilus because it provides nga po an acidic pH that prevents infection. While letter D, Listeria po yan, yung may characteristic na tumbling motility. Furthermore, on Lactobacillus acidophilus, it is called as Dodderline bacilli in the vaginal canal, while in the GI tract it is called as Boas oppler. And the culture medium for Lactobacillus acidophilus is your tomato juice agar. Again, number 67, letter C, produces large quantities of lactic acid for Lactobacillus acidophilus. Number 68, a non-spore forming slender gram-positive rod forming palisades and chains was recovered from a vaginal cultures and grew well on tomato juice agar. The most likely identification is letter A, Lactobacillus species, letter B, Neisseria species, letter C, Bacillus species, or letter D, Streptococcus species. So for number 68, again, let's look on our clues on the given statement. So we have there mentioned vaginal culture. We have there mentioned tomato juice agar. So tomato juice agar is a culture medium for your letter A, Lactobacillus species. Number 68, again, letter A, Lactobacillus species. Number 69, the mycobacteria are described as acid-fast because letter A, the organism cannot be stained with acidic dyes. Letter B, the organisms are deeply decolorized with acid alcohol. Letter C, once stained, the organism cannot be decolorized with acid alcohol. Or letter D, the organism are easily stained with acidic dye. So the answer is letter C. So once stained, the organism, once stained with your primary stain, which is carbolfishine, it will be taken up by the cell wall of the mycobacteria, which composed primarily of mycolic or high amount of mycolic acid, and then it will now resist decolorization with acid alcohol or 3% hydrochloric acid in ethanol. Hence, acid-fast organism will take, or acid-fast bacilli here will have a red color. So again, letter C, once stained, the organism cannot be decolorized with acid alcohol. Number 70, sputum samples for tuberculosis are optimally collected. We have letter A, in the morning on 3 consecutive days. That is for international standard. But for the Philippines, we are collecting 2 specimens in 1 day. Okay? While for international standard, we have in the morning on 3 consecutive days, positive result kapag 2 out of 3 turned out positive. In the Philippines nga po, 2 specimen in 1 day, 1 out of 2 is already considered positive. While since this one is an international examination, so we will follow the international standard. So in the morning, on 3 consecutive days, positive result kapag 2 out of 3 turned out positive. Number 71, sputum samples may contain normal flora and other contaminating microorganisms. So samples must be, okay, letter A, digested with N-acetyl L-cysteine. Letter B, decontaminated with 2% sodium hydroxide. Letter C, digested with trisodium phosphate. Or letter D, decontaminated with dithiotretol. So again, since sputum samples may contain normal flora and other contaminating organism, we need to decontaminate it with 2% sodium hydroxide. So we have 71, we have letter B. Letter A, on the other hand, your N-acetyl-L-cysteine is used to liquefy the mucus. While letter B, your 2% sodium hydroxide is used to decontaminate, for decontamination. Okay, next here is your Bartlett's classification, because as you know, no, when we are assessing the integrity of a sputum sample before we perform a culture, we need first to perform a gram stain for us to assess the quality of the sputum sample. For us to be sure that the specimen is really sputum, indicating that there is an inflammation, and not merely the presence of saliva, okay, or oral secretions. So it is recommended that all specimens containing purulent secretions should be cultured, whereas those containing oral secretions should be recollected. So generally, what we know about Bartlett's classification is that for epithelial cells, dapat po less than 10, while for number of neutrophils, dapat more than 25, to indicate nga po that there is an inflammation and there is uh, um, really a sputum sample and not the presence of saliva or oral secretions. So, dapat po less than 10 ang epithelials, so dapat more than 25 ang neutrophils. While this classification is more detailed and useful for your ASCPI examination. So, hindi pwedeng basta alam nyo lang na less than 10 at hindi pwedeng alam nyo lang dapat more than 25. So, we have a grading for this. For your neutrophils, sabi natin diba more than 25. So, if more than 25 po yun, plus 2. 10 to 25 plus 1. Fewer than 10, 0. And then kung meron pong presence ng mucus, plus 1. While for the number of epithelial cells per low power field naman po, again, dapat less than 10. So, pag less than 10, 0. While for 10 to 25, minus 1. Greater than 25, minus 2. Then, i-add lang po natin yon. Kapag ang total score ay 0 or less, then this indicates lack of inflammation or the presence of saliva. Okay? For example, no, pwede pong sabihin sa problem na there are 30 epithelial cells per low power field. So, kapag yun lang ang sinabi, then ibig sabihin minus 2 yun. So, 0 or less. So, recheck po natin yung specimen. No? It should be recollected, no? Because primarily, it contains nga oral secretions and not really sputum. Okay? Pero paano naman pag sinabi that there are 30 epithelial cells, tapos meron din daw pong 30 na neutrophil, so paano na po yung score nun? So, negative 2, tapos plus 2, so 0. So, 0 is still, again, scores of 0 or less indicate lack of inflammation or presence of saliva. So, again, it should be recollected. Because primarily, it is an oral secretion still. No? Pero kapag sinabi naman na, for example, may 30 na epithelial cell, then may 30 na neutrophils, and then may mucus na present. So, minus 2 plus 2, then plus 1. So, dahil may plus 1 na, nag-plus 1 na, total score mo na is 1. No? So, in that case, we can now process the specimen, no? As sputum sample. Okay? So, again, that's your Bartlett's classification. Okay, and then we also have here a CDC method to report the acid-fast bacilli. So, pag 0, report is negative, 1 to 2 per 300, positive or negative, and then repeat on the second slide, 1 to 9 per 100 field, 1 to 9 per 10 field, 1 to 9 per field or per oil immersion field. So, basically, that's 1,000 times total magnification ng field na yon. So, that is 3 plus, while more than 9 per oil immersion field is 4 plus. So again, that's the CDC method to report the acid-fast bacilli. Number 72, a sputum smear reveals an average of 5 acid-fast bacilli per 1,000 times field, or basically 5 acid-fast bacilli per oil immersion field. According to CDC guidelines, report this result as, so kung 5 per oil immersion field, again 1 to 9 per field is actually 3 plus. No? So we have letter D, 3 plus. Okay, while yung letter E po na 4 plus, dapat yan more than 9 per field. Okay, but the question here is 5 acid-fast bacilli per oil immersion field. So that is letter D, 3 plus. Next, number 73, When staining acid-fast bacilli with Truan's oramine rhodamine stain, potassium permanganate is used as a. So Truan's oramine rhodamine stain is a fluorescent stain for your Mycobacterium tuberculosis, wherein MTB bacilli will fluoresce yellow on a black background. While potassium permanganate here is used as letter B, quenching agent. Okay, so letter B, quenching agent. So quenching, meaning it decreases the fluorescence intensity. It decreases the fluorescence intensity. So 73, we have letter B, quenching agent. Potassium permanganate is used as a quenching agent to decrease the fluorescence intensity in the Truan's oramine rhodamine stain, wherein the MTB will fluoresce yellow on a black background. Number 74, which of the following is noted for a positive result for niacin accumulation? One of the most important biochemical tests in differentiating your Mycobacterium species is your niacin and nitrate reduction test, wherein niacin test positive and nitrate reduction test positive is true for Mycobacterium tuberculosis. So which of the following is noted for a positive result for niacin accumulation? We have letter A, Mycobacterium tuberculosis. Okay, next number 75. Acid-fast staining of a smear prepared from digested sputum showed slender, slightly curved, beaded red pattern after um, sorry, red mycobacterial rods growth on Middlebrook 7H10 slants produce buff-colored microcolonies with a serpentine pattern after 14 days at 37 degrees centigrade. Niacin and nitrate reduction tests turned out positive. What is the most probable presumptive identification? So unang-una po dito, it showed here yung acid fast staining nga niya, no, na, which describes an acid fast bacilli, red mycobacterial rods, and then nag-grow nga po siya sa Middlebrook 7H10, which is a culture medium for your Mycobacterium tuberculosis. This one is a clear medium for us to easily identify the colony or describe the colony. And this one produces buff color, meaning non-pigmented po siya na colonies with a serpentine pattern, characteristic din po of Mycobacterium tuberculosis. And then 14 days, so slow grower po yan, tama po yun for Mycobacterium tuberculosis at 37 degrees centigrade. And for biochemical test here, we have niacin and nitrate reduction test positive are actually the positive control for your Mycobacterium tuberculosis. So what is the most probable presumptive identification? We have letter A, Mycobacterium tuberculosis. Okay? For Mycobacterium kansasi naman po, this one is also known as the yellow bacillus because it is producing a yellow pigment. And this one is classified under group 1 photochromogen. So it produces the pigment in the presence of light. Mycobacterium kansasi is known as twin AT hydrolysis positive. Likewise, Mycobacterium gordonei is also noted to be twin AT hydrolysis positive. Okay, again tandaan, sino po ulit yung mga twin AT hydrolysis positive? Mycobacterium kansasi and Mycobacterium gordonei. They are twin AT hydrolysis positive. Next, we have your Mycobacterium ulcerans here, the cause naman po of Borrelia ulcers, and we also have the Mycobacterium avium intracellulare complex. So 75, again, letter A is for Mycobacterium tuberculosis. Number 76. So before po we move to the next number, we have here a table no, summarizing yung mga different biochemical identification of your mycobacteria. So, kailangan natin tandaan for niacin at saka nitrate reduction, positive for Mycobacterium tuberculosis. Yung urease test naman po, positive po siya for Mycobacterium fortitum. Likewise, pa-add din po ako dito kay Mycobacterium scrofulaceum. So, Mycobacterium scrofulaceum and Mycobacterium fortitum, they are urease positive. Again, Mycobacterium scrofulaceum and Mycobacterium fortitum, they are urease positive. Next, we have your twin AT hydrolysis positive. Again, this is true for Mycobacterium kansasi. And then the other one is your Mycobacterium gordonei. So they are twin AT hydrolysis positive, kansasi, and gordonei. Sa case naman po ng aryl sulfatase, pa-take note po ako, Mycobacterium fortitum, they are aryl sulfatase positive. Mycobacterium fortitum. Okay, it is also nice po to recall yung mga different Runyon classification wherein we are differentiating the mycobacterium based on their um, pigmentation as well as kung sila ba ay slow grower or fast grower. So or in their pigmentation, it can be a photochromogen, a scotochromogen nga po, and a non-chromogenic. No? Tapos we have slow growers and then we have mga rapid growers or fast growers. So yung mga group 1 po, these are photochromogen na slow growers. So we have example ng group 1 na photochromogen is your Mycobacterium kansasi. Again, the yellow bacillus, Mycobacterium marinum, or the one causing swimming pool granuloma. Group 2 naman po, so photochromogen will only produce will only produce pigment in the presence of light, while group 2 is your scotochromogen. Ito naman po, they can produce pigment even in the absence of light. So we have Mycobacterium gordonae, or the topwater bacillus, and Mycobacterium scrofulaceum, they are both scotochromogens. Okay? While group 3 naman po, yun na yung mga non-pigmenters na po yun na slow grower, like your Mycobacterium avium, no? Avium intracellulare. And then for group 4 naman, these are your rapid growers. So within a week, they will already grow, no? So having colonies. No? So for rapid growers, we have your Mycobacterium fortitum, or Fortitum chelonei, Mycobacterium flay, and Mycobacterium smegmatis. Again, they are aryl sulfatase test positive. So again, it's helpful din po na ma-recall natin no, yung mga biochemical test nila at saka yung mga groupings nila. No? Baka magamit natin no, in applying certain questions for the ASCP exam. Okay? So again, going back here ulit, niacin and nitrate reduction test positive, Mycobacterium tuberculosis, urease positive, fortitum and scrofulaceum, twin 80 hydrolysis positive, we have Kansasi and gordonae, aryl sulfatase test, we have Mycobacterium fortitum. Okay, so how to differentiate Mycobacterium scrofulaceum from Mycobacterium gordonae. As I said earlier, they are both under group 2, scotochromogen. Tama? Mycobacterium gordonae or topwater bacillus and your Mycobacterium scrofulaceum. Pareho po silang scotochromogen, meaning they are slow growers, they are producing pigment even in the absence of light. No? But to differentiate them, first we have your twin 80 hydrolysis positive. Diba? Kansasi and gordonae, they are twin 80 hydrolysis positive. And we can also differentiate them based on urease naman. Again, for urease test positive nga po, we have your Mycobacterium fortitum and Mycobacterium scrofulaceum. So for scrofulaceum, negative siya for twin 80 pero positive siya for urease test. Si gordonae naman, positive siya sa twin 80 hydrolysis test pero negative siya sa urease test. So Mycobacterium scrofulaceum and Mycobacterium gordonae. Next, number 76. Which non-pathogenic Mycobacterium species is isolated most often from clinical specimen and is called the topwater bacillus. So topwater bacillus is again your Mycobacterium gordonae. Okay, so we have letter D, Mycobacterium gordonae. Again, tandaan, Mycobacterium gordonae is a scotochromogen. Mycobacterium gordonae is positive for twin 80 hydrolysis test. Okay, then negative po siya sa urease test. Okay? Next po tayo, number 77. Interferon gamma release assays have become more widely used for the diagnosis of. So interferon gamma release assay po or IGRA is a blood test for Mycobacterium tuberculosis infection. Ano po ba yung mga test natin kung ma-recall nyo po? Di ba we have your tuberculin skin test or the purified protein derivative. Ang problem lang po sa PPD or purified protein derivative or your tuberculin skin test is that it can't differentiate active infection from latent infection, from past infection, and from those patients who received prior vaccination before. Ibig sabihin, kung ikaw ay hindi niya kayang ma-differentiate kung ikaw ba ay may active na TB, ikaw ba ay may latent na TB. Latent TB means nasa iyo yung bacilli, may bacilli ka no, nasa lungs, pero hindi pa transmissible to other person kasi na-contain pa siya ng immune system natin. No? Mostly po sa Philippines, no, since endemic na sa atin ang tuberculosis, upon contact nga with some individuals with TB, no, kapag na-inhale natin yung tubercle bacilli, sa lungs natin, nako-contain natin dyan yung tubercle bacilli. So, hindi pa siya naging active na TB for transmission. So, your body is still containing it. No? So, that's latent tuberculosis. Okay? May possibility na mag-progress, no? But if you have a good immune system, then you can defeat the tubercle bacilli. So, again, that's latent TB. So, yung purified protein derivative, yung skin test, mag-positive siya sa active TB, sa latent TB, okay? Sa past TB infection, kung nagka-TB ka before pero magaling ka na, still you will turn out to be positive for purified protein derivative test, yung mga tuberculin skin test. At saka kung na-vaccinan ka before ng BCG vaccine. Again, the vaccine for MTB is your BCG vaccine or Bacillus calmette-guerin from Mycobacterium bovis. Okay? However, hindi nga po ganun kaganda yung efficiency ng vaccine, so you are not fully protected. But research states na even though hindi ka ganun ka-protected sa respiratory tuberculosis, no, you will be protected from severe forms of TB. Like for example, meningeal TB, TB of the bone, no, and in other organs. No? So you are protected if you have received the Bacillus calmette-guerin vaccination before. Again, skin test or your tuberculin skin test is under type 4 hypersensitivity. Okay, so that's for your purified protein derivative. So yung blood test naman po, yung interferon gamma release assay, kasi upon with the infection nga po ng tubercle bacilli, so our WBC is producing yung mga interferon gamma. No? So we are measuring po ito, yung interferon gamma release assay, which is a blood test for your Mycobacterium tuberculosis infection. So ang IGRA, ang kinagandahan niya ngayon sa purified protein derivative sa mga skin test is that interferon gamma release assay will be negative kung past infection na siya. So kung past infection na siya, maging negative ka na sa interferon gamma release assay. At saka kung na-vaccinan ka before, maging negative ka din sa interferon gamma release assay, unlike sa purified protein derivative tuberculin skin test. Okay? So mas maganda siya in a way, no? Pero yung interferon gamma release assay, ang problem sa kanya, you can't still differentiate active from latent TB. So kahit na si interferon gamma release assay, na-differentiate niya na kung ikaw ba ay may past infection, negative ka na dyan. No? Kung nabigyan ka ng vaccine, negative ka na dyan. No? Pero ang sa IGRA, hindi pa rin niya kayang ma-differentiate yung active TB sa latent TB. Okay? Kaya we have better tests. No? And that now includes your syempre acid-fast bacilli, no? So if you've been able to detect, no, the presence of acid-fast bacilli in the sputum, then really you are having an active type of active TB already, no, or active infection with tuberculosis. Okay? Other tests, syempre culture. Okay? And currently now, no, we are also using Gene Expert. No? So we're in Gene Expert can also identify resistance. Particularly for MTB, we have rifampicin resistance. No? At kapag yung patient nag-exhibit na po ng rifampicin or rifampin resistance, then they are already classified as multi-drug resistant tuberculosis. Okay? So again, interferon gamma release assay is have become more widely used for the diagnosis of tuberculosis. Okay? Next, number 78. Okay, poor dental hygiene can lead to osteomyelitis of the jaw. What organism is most often responsible for this type of infection? Is it A. Actinomyces? We have letter B. Staphylococcus aureus, letter C. Prevotella, or letter D. Fusobacterium species? So for osteomyelitis of the jaw, lumpy jaw, having a characteristic molar tooth colonies, we have letter A, actinomyces species. Actinomyces species. So we have here po quick differentiation of your actinomyces and nocardia. No? We are differentiating these two because they are both gram-positive, they are both filamentous, so they are both fungus-like bacteria. But to differentiate them, nocardia is an obligate aerobe, while actinomyces naman po is an obligate anaerobe. So nocardia is aerobic, actinomyces is anaerobic. So actinomyces automatically here is catalase negative, being an anaerobe. So this one is catalase negative, while nocardia is catalase positive. Nocardia is also partially acid fast, while actinomyces is non-acid fast. And for their pathology, nocardia is associated with pulmonary-like tuberculosis, while actinomyces is associated with lumpy jaw, characteristic sulfur granules, and molar tooth colonies. Characteristic. So again, that's the difference between actinomyces and nocardia. So for the next question, number 79, a bone marrow transplant recipient patient on immunosuppressive therapy developed pulmonary abscess abscess with symptoms of neurologic involvement. A brain abscess was detected by MRI, and aspirated material grew an aerobic filamentous branching gram-positive organism which stained weakly acid fast. The most likely etiologic agent in this case would be, so again, look at the clues here. So nakalagay po dyan, aerobic. So again, between the two, no, between nocardia and um, actinomyces, we know that nocardia is aerobic. They are both filamentous, they are both branching, and again, partially acid fast nga po is your nocardia. So we have letter B, nocardia asteroides. Okay, so we have nocardia asteroides, letter B. Okay. Next, we also have here your Treponema pallidum subspecies pallidum, causing syphilis, as we know, or venereal syphilis, transmitted by sexual contact. It is a sexually transmitted disease. It can also be transmitted through blood transfusion or transplacental route. So primarily, we have four stages for your syphilis infection. So we have primary syphilis, characterized by hard chancre, or painless lesions. So hard chancre, painless. Okay? While again, in comparison nga po for soft chancre naman or chancroid, which is characterized by painful ulcerations in the genitalia, that is true naman po to Haemophilus ducreyi. So Haemophilus ducreyi, painful, hard chancre, soft chancre or chancroid and painful for Haemophilus ducreyi, while for primary syphilis, it is characterized as hard chancre, painless. Next, for secondary syphilis, we have condyloma thalatta, which are presence of wart-like lesions in the body. And then primary, secondary, and then we have latent syphilis. So latency, so absence of clinical symptoms, and then it can progress further to tertiary syphilis, wherein there will be already presence of granulomatous lesions or gumas, as well as risk for neurosyphilis. So we have the primary, secondary, latent, and tertiary syphilis under your Treponema pallidum subspecies pallidum infection. Okay? Number 80, the stage of syphilis characterized by granulomatous lesions in various organs of the body, including cardiovascular and neurological disorders is. So again, characterized by granulomatous lesions in the various organs of the body, including cardiovascular and neurological disorders. This one is part of your tertiary syphilis. Okay, so we have letter C, tertiary syphilis. Next, we also have your Borrelia burgdorferi. So this one is the agent of Lyme disease transmitted by ticks. So dito po meron tatlong stages. So stage 1 is the appearance of the lesion, erythema chronicum migrans, described as bullseye lesion. Again, pag na-encounter natin bullseye lesion, that is erythema chronicum migrans for the primary stage of, or stage 1 of Borrelia burgdorferi, or Lyme disease. Borrelia burgdorferi infection or Lyme disease. Next, for Also, don't confuse bullseye lesion with bullseye colonies. No? So, erythema chronicum migrans, stage 1 of Lyme disease caused by Borrelia burgdorferi is described as bullseye lesion. While magkaiba po yun sa bullseye colonies. Bullseye colonies is exhibited by Yersinia enterocolitica as it grows in CIN or Cephsalodine irrigasan novobiocin. So that is for the bullseye colonies. No? Yersinia enterocolitica grown on Cephsalodine irrigasan novobiocin or CIN. While for bullseye lesion, that is your erythema chronicum migrans, stage 1 of Borrelia burgdorferi infection or Lyme disease. Okay. Next, number 81, the stage of Lyme disease characterized by the appearance of erythema chronicum migrans or bullseye lesion. So this one is part of letter A, primary. Okay? So primary infection. Next, number 82 or stage 1. Which of the following is a cause of community acquired atypical pneumonia, often referred to as walking pneumonia? So this one is caused by letter D, Mycoplasma pneumoniae. So we call this one community acquired atypical pneumonia because it will exhibit virus-like symptoms like dry cough, um, contrary to purulent na bacterial infection. Okay, so primary atypical pneumonia, so like virus that exhibits dry cough, but this one is self-limiting naman. No? So we have Mycoplasma pneumoniae. Okay, Mycoplasma pneumoniae also contains an eye-like antigen in its cell membrane. Hence, it is or infection with Mycoplasma pneumoniae will cause anti-capital I production, and anti-capital I is an IgM. So this one will cause cold agglutinin or cold auto-agglutination. So for cold agglutinin, cold auto-agglutination, we have Mycoplasma pneumoniae. Okay? So Mycoplasma pneumoniae causing primary atypical pneumonia or walking pneumonia. So Mycoplasma po, in general, they lack cell wall as we know. So ibig sabihin po, hindi magwo-work sa kanila yung mga drugs na cell wall synthesis inhibitor. So drugs like beta-lactam drugs, penicillin, cephalosporin will not work on all mycoplasma and urea plasma species because they lack cell wall. Okay, so hindi mag-work yung mga drug na cell wall synthesis inhibitor like penicillin, cephalosporin, and other beta-lactam drugs. Okay? So again, that's for your mycoplasma. Next, number 83. Chlamydial infections have been implicated in. So we have letter A, urethritis and conjunctivitis. Letter B, gastroenteritis and urethritis. Letter C, neonatal pneumonia and gastroenteritis. Letter B, neonatal meningitis and conjunctivitis. Pakitandaan po ako for Chlamydia trachomatis or for your chlamydia infection, we have TRIC, T-R-I-C, trachoma, IC, inclusion, conjunctivitis. So we have letter A, urethritis and conjunctivitis. So trachoma, inclusion, conjunctivitis. Okay, so that's for chlamydia trachomatis. And then, chlamydia trachomatis po is not free living, so it requires a cell for us to culture. So we are using po McCoy cell for chlamydia trachomatis. So McCoy cell or cell culture serve as the reference method. And the cell line most commonly used are your McCoy cell. Other tests includes direct fluorescent antibody test, and then which is used to detect chlamydia trachomatis elementary bodies. So that's your direct fluorescent antibody test. We also have nucleic acid hybridization test and nucleic acid amplification steps. Such as the usage nga po of PCR, no? Wherein we can now test here endocervical swab, male urethral swabs, and urine sample from both male and female. Again, that's for chlamydia. So letter A again, causing urethritis and conjunctivitis. 83, letter A. Okay. Next po tayo, this one shows nga po yung different rickettsia. Okay, so we have here the different rickettsia, the species, or rickettsia rickettsii, causing Rocky Mountain spotted fever, transmitted by ticks, rickettsia acari. So we have here causing rickettsial pox. Transmission is through mites. Then we have here your Rickettsia prowazekii, your epidemic typhus, transmitted by lice. Sporadic typhus, transmitted by flying squirrels, and Brill-Zinsser disease is the reactivation but a milder form of your epidemic typhus. Rickettsia typhi is the murine typhus. Vector here is fleas. Then we also have the Orientia and Rickettsia um, Chushugamushi, which is causing scrub typhus transmitted by mites or chiggers. Q fever naman is again, Coxiella burnetii naman po is the one causing Q fever, transmitted by ticks and aerosol. Tandaan po to, ang nag-iisa lang sa lahat ng Rickettsia family na pwedeng matransmit through aerosol is Coxiella burnetii. Okay, then we have the Ehrlichia, ticks naman po yan. And then for Rocalimia or Bartonella quintana, so this one, the infection, it is causing trench fever and transmitted through lice. Okay? Para sa akin po, mas easier po yung ganito. Para na-apply ko na yung Will-Felix test, na-classify ko pa yung different rickettsia. Okay, so parang ganito lang, no? OX2 po, ang source po ng OX2 is Proteus, ng OX2 sa ng OX19 is Proteus vulgaris, while the source for OXK is your Proteus mirabilis. So again, this one is the classic Will-Felix reaction. Okay. So, yung OX2 positive po, OX19 positive, OXK negative, that is true for your epidemic typhus. Again, epidemic typhus is caused by Rickettsia prowazekii, tama, transmitted through lice. Tama, tapos may mga other form yan like your sporadic typhus, which is transmitted by flying squirrels, and we have your Brill-Zinsser disease, which is the milder form nga po of epidemic typhus. Okay? Reactivation siya, no? Pero mas milder form yung Brill-Zinsser disease. So again, under po yun ng epidemic typhus dito. Under naman ng murine typhus dito, we have your Rickettsia typhi transmitted by fleas. No? So OX2 positive, OX19 positive. Another one is your causing spotted fever group or your Rickettsia rickettsii causing Rocky Mountain spotted fever. So Rickettsia rickettsii causing Rocky Mountain spotted fever. So this one is transmitted po by ticks. No? So ticks din po yan. OX2 positive, OX19 positive. So tatlo yon, no? Tatlo po yung OX2 positive saka OX19 positive. We have your Rickettsia prowazekii causing epidemic typhus, Rickettsia typhi causing murine typhus, and your Rickettsia rickettsii causing Rocky Mountain spotted fever. Next, again, prowazekii is transmitted by lice. Typhi, fleas. Rickettsia rickettsii naman po, we have ticks. Okay? Next, negative naman po sa OX2 at saka sa OX19, pero positive naman po siya sa OXK. So this one is true for your scrub typhus caused by Rickettsia or Orientia Chuchugamushi causing scrub typhus. Okay? So this one is transmitted by mites. So transmitted by mites. Next, we have your Q fever. Q fever is, so ito naman pong mga natitira, lahat siya negative na. So negative for OX2, OX19, saka OXK. So this is true for your Q fever. So Q fever is caused by Coxiella burnetii. And this one is transmitted through ticks. Possible nga rin po dito ang aerosol. So again, possible din ang transmission through aerosol sa Coxiella burnetii causing Q fever. Then lastly here, we have your rickettsial pox. So again, negative din po siya sa Will-Felix test, OX219 saka OXK. And rickettsial pox is caused by Rickettsia acari. So rickettsial pox is caused by Rickettsia acari transmitted through mites. Okay? So again, tandaan, parang madali na lang isahang memorization, no? OX2, OX19 positive, OXK negative, epidemic typhus, urine typhus, at saka Rocky Mountain spotted fever. Tapos syempre, kailangan alam mo kung anong rickettsia yon, no? Yung bacterial organism, tapos ano yung um, vector nila, no? Kung lice ba, kung fleas ba, kung ticks ba. Okay? And then, under naman ng scrub typhus naman, negative naman siya sa OX sa OX19, it is positive naman po sa OXK. Okay? And that is for true nga po for your scrub typhus caused by Rickettsia chuchugamushi. Vector po is mites. While the rest dito, negative na sa lahat. No? So we have your Q fever nga po, or Coxiella burnetii, transmitted through ticks or aerosol. So the only Rickettsia family that can be transmitted through aerosol. And then we have rickettsial pox, caused by Rickettsia acari. Mites nga po dito yung vector. No? So negative din po siya dito. Okay, so again, just be familiar po with the Will-Felix reaction and then the different types nga po ng rickettsial conditions dito. The bacteria, no, ano Rickettsia species, and then yung vector. The gold standard serologic test for rickettsiosis is the indirect immunofluorescent antibody assay. So again, indirect immunofluorescent antibody assay serve here as the gold standard. Okay. Next po tayo, number 84, rickettsia infecting man multiply preferentially with which of the following cells? So we have letter D, endothelial cells. 84, we have letter D, endothelial cells. Okay. Next, number 85, which selective medium is used for the isolation of gram-positive organisms? So letter A, yung modified letter D muna tayo. Letter D, modified Thayer-Martin. Hindi po yan because modified Thayer-Martin is for Neisseria gonorrhea. Chocolate agar plate po yung base niya. Nag-add lang tayo ng vancomycin to inhibit gram-positive, colistin to inhibit gram-negative, vancomycin, colistin, and as well as in the addition of your nystatin to inhibit the growth of fungi, and trimethoprim lactate to inhibit the swarming of the proteus. So, that's your modified Thayer-Martin. So, again, mali din po yan, no? Then, mali nga din si letter A, no? Yung Columbia, mali nga po si for number 85, mali nga po si letter D because modified Thayer-Martin is for Neisseria gonorrhea. Mali din po si letter C because Eosin methylene blue is for Enterobacteriaceae. So for gram-negative bacilli po yan. Usually ginagamit yung Eosin methylene blue or for your Enterobacteriaceae. While letter B naman, trypticase soy agar with 5% sheep blood. Hindi po siya, ang tanong kasi ay selective medium, no? While trypticase soy agar is only a nutritive medium. So hindi po siya selective for the isolation of gram-positive. So mali din po si letter B. So the answer is letter A, Columbia, colistin nalidisic acid with 5% sheep blood agar because colistin is used to inhibit nga po gram-negative. So we can use now your Columbia colistin nalidisic acid agar as a selective medium for the isolation of gram-positive microorganisms. Okay, so we have 85, we have letter A. Next po tayo, number 86, supplementation with hemine and vitamin K will enhance the recovery of. So, hemine and vitamin K. Pag na-encounter po yung vitamin K is your phylloquinones. It is one of the fat-soluble vitamins, no? Vitamin A, D, E, and K. Tama po, no? They are important in coagulation, as you know, in hema. But for micro purpose, vitamin K is essential for the recovery of anaerobic bacteria. So we have letter C, anaerobic bacteria. 86, letter C. Okay. Next, number 87, obligate anaerobic gram-negative bacilli that do not form spores, grow well in 20% bile, and are resistant to penicillin 2 unit disc. I think we should also highlight here the word resistance, no? To penicillin. Okay. 2 unit disc are most likely, so letter A, Porphyromonas, letter B, Bacteroides, letter C, Fusobacterium, and letter D, Prevotella. Again, these organism, no, given the choices are all um, anaerobic um, organisms. Okay, so they are all anaerobic. Una, to differentiate here is the grow well in 20% bile, no? Because the only capable here of growing well in 20% bile is your Bacteroides species, no? While the rest will be susceptible to or inhibited by, better term is inhibited by the bile. So meaning they can survive in that 20% bile, while Bacteroides can grow well in 20% bile and are resistant to penicillin. Yes, because Bacteroides is also producing beta-lactamase, making it resistant to penicillin. So the answer here is Bacteroides species. Okay? So Bacteroides po are actually indigenous flora of the colon. Though they are normal flora or indigenous flora of the colon, they should not be present in the blood, no? However, in case nga po of gastrointestinal tract trauma, it may cause septicemia. It may also cause septicemia, which is actually difficult to manage because it exhibits drug resistance, no? Particularly nga po with penicillin and other beta-lactamase or other, sorry, with other beta-lactam drugs because Bacteroides nga po is producing beta-lactamase. In addition, Bacteroides also contains a capsule. So, meron din po siyang capsule. Meron siyang polysaccharide capsule that inhibits phagocytosis. Okay? So, difficult to manage din siya in case nga magkaroon ng possible na septicemia infection. But nevertheless, again, this one is the indigenous flora of the colon. For Bacteroides po, we are usually using the culture medium kanamycin, vancomycin, lake blood agar because Bacteroides is known as vancomycin resistant. Okay? So Bacteroides is also vancomycin resistant. Okay? Kaya nga siya nag-grow sa kanamycin, vancomycin, lake blood agar. Kasi nga, it is resistant to kanamycin and vancomycin. Hence, nag-grow siya sa medium na yon, no? Yung kanamycin, vancomycin, lake blood agar. Okay. Moving on with the other species, again, anong kinakatandaan kay Bacteroides? Indigenous flora of the colon, can grow nga po in kanamycin, vancomycin, lake blood agar. So, ibig sabihin, it is resistant to kanamycin and vancomycin kasi nakapag-grow nga siya doon. It can grow well in 20% bile, so it can survive in this bile content. And they are resistant nga po to penicillin 2 unit disc. So, again, they are producing nga po beta-lactamase. Hence, they are resistant to many beta-lactam drugs such as penicillin, cephalosporin, bacitracin, and other beta-lactam drugs. Okay? And they also contains a polysaccharide capsule, thus inhibiting phagocytosis. Okay? Sa case naman po ng Fusobacterium, kapag naka-encounter po kayo ng mga problems with Fusobacterium, usually they are described as spindle-shaped. And then they are known to be susceptible to penicillin. Okay? And they will also not grow in 20% bile. Sa case naman po ng letter D, Prevotella, Prevotella po is also inhibited by bile, though Prevotella also shows resistance. So Prevotella will also show resistance to beta-lactam drugs such as penicillin. Okay? Pero ang Prevotella will be inhibited by the bile. No? So hindi siya mag-grow in the presence of 20% bile, unlike sa Bacteroides. Okay? Ano pa kailangan tandaan? Prevotella po and Porphyromonas, baka po ma-encounter natin. Prevotella and Porphyromonas are known to produce brick red fluorescence under UV. So yung letter A po dito, si Porphyromonas, saka sa letter D, Prevotella, they are producing brick red fluorescence under UV light. So they are producing brick red fluorescence under UV light. Okay? And then, so basically, yun po, no? For your gram-negative. Mag-add din po tayo, we have Vilonella. Vilonella, on the other hand, no? Veillonella. So we have your Vilonella. Vilonella is a gram-negative cocci, anaerobic. Diba? All cocci are gram-positive except for your Neisseria, your Branhamella or Moraxella, and Vilonella, wherein Vilonella is strictly anaerobic. So Vilonella is the only gram-negative cocci anaerobe. So we have Vilonella. Okay? In addition, add din natin si Propionibacterium acnes. Propionibacterium acnes, is syempre is the one associated with the growth of acne or pimples. In addition, it is a normal flora in the skin, so it is also capable of being a contaminant, particularly a blood contaminant um, during culture or a blood culture contaminant, yung Propionibacterium acnes. So again, for for not only gram negative but for your anaerobic organism, tandaan si Bacteroides, tandaan si Fusobacterium, Prevotella. We also have Porphyromonas, Vilonella, and your Propionibacterium acnes, which again can serve or may serve as a contaminant in blood cultures. Okay? Next, number 88. Cerebrospinal fluid should be cultured immediately, but if delayed, the specimen should be. So for CSF specimen, again, it should be acid nga or performed nga po. Again, in micro, it should be performed immediately. But if delayed, the specimen should be letter D, incubated at 37 degrees centigrade and cultured as soon as possible. Okay? Nandito lang po, sorry. Again, for CSF, tama po yun. Dapat, if hindi siya kaya maasi immediately, it should be incubated at 37 degree centigrade. Okay? And then, it should be cultured as soon as possible. While, for viral specimen, kung yan po ay viral specimen, then that should be refrigerated at 4 to 6 degree centigrade. For serum sample naman, mga immunological studies, then we are storing it at a frozen temperature at negative 20 degree centigrade. Okay, for immunological studies. For viral specimen, refrigerated at 4 to 6 degree centigrade. For CSF specimen nga po, cultured immediately or incubated at 37 degrees centigrade and then cultured as soon as possible. So 88, we have letter D. Okay?